Professor Ezugwu. He's a professor of obstetrics and gynecology at the Department of Obstetrics and Gynecology, College of Medicine, University of Nigeria, Itukozala campus. And he's a consultant obstetrician and gynecologist, University of Nigeria Teaching Hospital, Itukozala, Enugu State, Nigeria. He is the director, Institute of Maternal and Child Health, University of Nigeria, Nsukka. He's also the Dean, Faculty of Clinical Medicine, State University of Applied and Medical Sciences, Igbo Enu, in Enugu State, Nigeria. He holds a Bachelor of Medicine, Bachelor of Surgery degree from the University of Jos Plateau State, where he graduated as the best graduating student in internal medicine. He is a fellow of West African College of Surgeons, Faculty of Obstetrics and Gynecology, and a fellow of the International College of Surgeons. He obtained Advanced Master of Science degree in Bioethics from Catholic University, Leuven, Belgium, Radboud University, Nijmegen, the Netherlands, and University of Padova, Italy, under the Erasmus Mundus Mobility Program. He is currently the chairman, University of Nigeria Teaching Hospital Health Research Ethics Committee, and the University of Nigeria College of Medicine Health Research Ethics Committee. He's a member of Ethics and Privilege Committee, West African College of Surgeons, and the chairman, Scientific Committee, Bioethics Society of Nigeria. He's a program coordinator, Eastern Nigerian Research Ethics Program. Ethics program involved in training and retraining of health research ethics committees in Southeast and South Nigeria. He's a key faculty member, Bioethics Unit, Institute of Public Health, University of Nigeria. He was the past Assistant Secretary General, Christian Medical and Dental Association of Nigeria, Plateau State. His research interest is in the area of sexual and reproductive health, maternal and child health, malaria in pregnancy, infertility and assisted reproduction, and bioethics. He has over 80 publications in local and international peer-reviewed journals, and has over 50 conference presentations at both local and international conferences. Professor Euzebus Ezugwu was the 189th inaugural lecturer of the University of Nigeria, Nsukka. So with joy in our hearts, let's make welcome our presenter today, Professor Euzebus Ezugwu. So you can go ahead with the presentation.
Thank you very much for that very detailed introduction. I want to greet every one of you, all the officials of CMDA, they're present, and those that are not even present, to greet every one of you for the opportunity that you've given to me to deliver this lecture. I see it as an honor to be called upon to come and deliver this lecture on bioethics, the Christian perspective on the past, present, and the future. So it's my pleasure to be here and to deliver this lecture in the next 30-35 minutes. So I plead to stand on the existing protocol already established by the moderator. So once again, thank you for the opportunity to deliver this lecture. I've been told that I have about 30 minutes, 35 minutes to do justice to this topic. So I'll, as much as possible, keep to time so that at the end of the day, we can have some few questions. So feel free to put down your questions and then we'll discuss at the end of it all. So the topic is bioethics, Christian perspective on the past, present, and future. That is my name. Please, because of problem of network in our environment, please, if you can't hear me, just let me know so that I will not be talking to myself. Thank you. So my objective in this few minutes is to explore what bioethics means, discuss the emergency of bioethics, and the importance of bioethics and bioethical principles, and how Christian faith shaped bioethical discussion. And I highlight the Christian perspective in the past, present, and future, then we conclude. So the issue now is, what is bioethics? It's important that I define what is bioethics, because even by the time I had become a consultant, I didn't know what bioethics meant. So I heard about it and I had to read about it, and I developed interest and had to pursue a career in that field. So what is bioethics? Bioethics is just derived from the Greek word bios, which means life, and ethics, which means ethics. So it talks about ethics as it applies to life science. And some quarter is also called biomedical ethics. So, and you know, ethics is a generic term covering several different ways of understanding and examining the moral life. So ethics represents a set of principles that helps to answer the question, what should be done in a given situation, all things considered. So ethics is very important because it helps us to understand and examine the moral life. According to Socrates, a great philosopher, he said an unexamined life is a life that is not worth living. So ethics helps us to reflect and examine our moral life. So what is now bioethics? Bioethics involves a critical and a systematic reflection of morality as it applies to biomedical, healthcare, environment, and research issues. So the premise of such moral and rational reasoning are significantly informed by discipline from natural science and also from social science. So it is commonly understood as a generic term that discusses medical ethics, which includes public health, animal ethics, and environmental ethics. So bioethics is closely related to philosophy, and it drives its explanation and reasoning from the discipline of philosophy. Some people have said, but it's also said that bioethics is a subset of philosophy, which is an integral branch of practical or applied philosophy. So, in effect, bioethics is a form of applied ethics. And unlike theoretical philosophy, it has practical implication and also pressure. So how did we arrive at bioethics? How did the bioethics emerge in the first place? The emergence of bioethics can be traced to a sudden and remarkable progress in biomedical science and also advancement in technology in biomedical area. For example, in the area of genetic and genomic medicine, the area of stem cell research, organ transplants, cloning, assisted reproductive techniques, and also in innovative treatment. So the shift in societal and ideological concept of biomedical practice and biomedical research, leading to blurring of boundaries, called for people now to say, look, we have to develop this area that can look at, because things were moving with the technological developments, new things that were not natural, that were not there before, started emerging. New challenges, new dilemmas started emerging. And even in terms of research, new things beginning to happen. Before, research was meant to benefit people. But along the line, all kinds of research came about. Must have heard about the Nazi war experiments that was conducted, even the Tuskegee syphilis trial that was done in the US. All these things came on board and brought a lot of confusion in the system. So the increasing frequency and complexity of ethical, professional, and practical dilemmas with no clear-cut guideline in certain areas and aspects of life led to the emergence of bioethics. Also, the debates over the moral status of animals, nature, environment, the debate over climate changes, nuclear waste, water and air pollution, the clearing of the deforestation, the large-scale livestock farming, and also the genetically modified food and organism, and even bioterrorism. All these things brought issues along the line. And of course, with these things that are emerging, there was no law that could address those issues. So there was a lacuna in the legal system in dealing with these emergent issues, such as abortion, euthanasia, physician-assisted suicide, and assisted reproductive technique. So because of all these things, this issue of now trying to reflect on this ethics that involves life science came on board. So also diseases that were strange to us that we never knew about came on board. And each of them came with its own challenges, ethical issues like the Zika virus, the Ebola, even the SARS. So we're increasing regular and social media coverage. So when this thing happens, there's always the media hype of some of these things. So the society with their goal, with media coverage and all that. So another thing also that brought about the emergence of this was the globalization of biomedical research. You can see people now, researchers have planned out in high-income countries, executed in low-income countries. Sometimes you do not know the reason why they're coming. Is it because they really want to favor the people in a low-income country, or is it part of exploitation? So a lot of things were happening. So humanity was facing unprecedented challenges virtually in all cultures and virtually in all societies. So this led to the emergence of bioethics. Bioethics is closely related to human rights and law, but they are not identical, you know. And of course, in pluralistic society or multicultural world, there are various different moral traditions, major international human rights agreements that can provide a foundation for bioethics that is accepted across all nations, cultural boundaries. What of ethics and law? It is important for us to know that ethics is different from law. Although ethics may be incorporated in certain aspects of law, but ethics actually prescribe higher standards than law. You know, and occasionally ethics requires that physicians or scientists or researchers disobey a living law that demands unethical behavior. It is called that any law that is found to be good, usually there is moral or ethical basis for it. While laws are expressed by legislation and court ruling, ethics are usually expressed through guidelines, codes, and associated breach. And the associated breach are not always legally enforceable. So now, what is bioethics? As I said before. So in summary, bioethics is a philosophical study of the ethical controversies brought about by advances in biology and medicine. As we go along, you will see the advances that have occurred in medicine and in biology that have thrown up a lot of ethical issues that the whole world, but at the point there was a dilemma. Should we or should we not? So bioethics are concerned with ethical questions that arise in the relationship among life science, biotechnology, medicine, politics, law, philosophy, and theology. So applied bioethics is an applied ethics. It's applied to actual ethical problem. Now let's look at ethics that concerns us, because this is Christian Medical Dental Association, Nigeria. So one thing that concerns all of us that we must look in terms of this particular nature is medical ethics. And what is medical ethics? It is the study of moral values and judgment as applied to medical practice. It supplements the statutory laws that govern medical and dental practice in a given place. So usually for any country, there's usually a code of medical ethics. Sometimes you have international code of medical ethics that cuts across. This is a formal statement of the correct attitude expected of physicians. And that is actually what guides physicians. And these codes are derived on ethical principles. So medical ethics deals with this ethical principle that govern professional conduct in medicine. So it is an obligation of physicians medical ethics is an obligation of physicians towards their patient, as well as some obligation towards other physicians. So these ethical principles are actually foundational beliefs which guide or influence the action of clinicians in the care of their patients. So this foundational belief, every medical or dental person must have this knowledge of this foundational belief, because that is what is going to guide his action in practice. So medical ethics creates all activities of physicians. The central role of ethics in the practice of medicine cannot be too highly rated, because medical practice involves a lot of decision making in the process of managing patients. So if you do not understand this foundational belief, if you do not understand this ethical principle, you may have challenges taking some decisions in medical practice. So that is why medical ethics is important. So the ethical principle of respect of person, informed consent and confidentialities are basic to the physician-patient relationship. Of course, you cannot be a good doctor if you do not have a very good doctor-patient relationship. So medical ethics helps us to apply those principles like respect of person, informed consent, and confidentiality. So it helps us to apply this principle as we manage cases. Now, when we look at the principle of medical ethics, there are 4 key principles that come into perspective, and that is non-maleficence, autonomy, justice, and beneficence. I'm sure most of us here are aware of it. I'll just highlight it and move on. For example, the beneficence. In beneficence, is talking about the principle of beneficence refers to a statement of moral obligation to act to the benefit of others. So in this case, for us as clinicians, as doctors, the principle of beneficence demands that we act in such a way as to benefit our patients. And that is the principle of beneficence. Now, the principle of non-beneficence, of course, looking at the Latin maxim primum non nocere, which means do no harm, states that, look, in clinical practice, physicians should abstain from what is deleterious and mischievous, should not cause harm. But in reality, there are instances in clinical practice that there is a conflict between the principle of non-maleficence and that of beneficence. So, for example, a patient has ovarian cancer and they want to treat with cytotoxic drug like carboplatin. We know that it is toxic, it causes harm, but you still need to use it to treat ovarian cancer. Why? Because you do a risk-benefit analysis and you find out that the benefit outweighs the risk. Then another key point in medical ethics is autonomy, which is, from Greek word, self, autos, which is self, nomos, governance. And that tells us that the fact that an adult with capacity to make an informed choice has the right to determine what happens to his or her body. So it's no more like those days in the past, whereby we just decide what we need to do for the patient. The patient must be carried along to decide what happens to his own body, provided it does not impinge on the autonomy of another person. So to respect autonomous agents is to acknowledge the person's right to hold view, to make choices, and to take decisions based on the values and beliefs. So in this case, it is important for us to know that the autonomy overrides beneficence. Then a non-ethical principle in medical ethics that we must also remember is the principle of justice. And it is the proposition that all persons should be given what is their due and what they are owed. So it involves fair and equitable distribution of benefits and burden to all participants in the social institution. Now, it is so simple. In those days, some people would apply this principle and you get yourself fine and good, coasting. But with the advances that has occurred currently, it discovered that it has become difficult for this ethical principle to resolve all these issues. For example, in the advancements in medicine, like in assisted reproductive technology, in the issue of cloning, the issue of stem cell research, the issue of organ transplantation. These are advances that have occurred. And of course, because of these advances, you discover that the principle of medical ethics alone may not be able to answer the question. The issues are great. Let's just have an overview what is currently ongoing. For example, we know that for us to have a baby, the male and the female will come together in a natural way, have sexual intercourse, and of course, fertilization that will occur in the tubes. And then finally, we go and implant in the uterus. But of course, we know in modern technology of vitro fertilization, these steps we can overcome or bypass all these systems such that infertile couples can easily access care without naturally going through the natural process. And of course, with the coming of this in vitro fertilization and embryo transfer, it brought its own challenges. It brought its own ethical issues. And of course, infertile couple, what they just need to do is to access technology to be able to have a baby. And some of this will raise a lot of ethical issues. Example of assisted reproduction is the issue of artificial insemination, issue of in vitro fertilization and embryo transfer, issue of surrogacy, and even cloning itself. All these things has its own ethical issues. For example, of course, we know in 1978, there was a breakthrough leading to the birth of the first test tube baby. And that first test tube baby named Leslie Brown, the mother of the test tube baby. So you can see the couple that had this young woman then that had this, of course, the woman herself, as Louise Brown, has her own children. And of course, you know, this thing happened some 40-something years ago, almost 5 decades ago. So a lot of development has even occurred, a lot of advancement. So today, over 10 million babies have been born with IVF. And of course, even in Enugu, you know that there is a lot of IVF centers. And this has raised issues, ethical issues. For example, bypassing the natural method of conception, is it right? Is it morally acceptable to create life in a laboratory? What of when we fertilize embryos? We fertilize more than we need. After transplanting, what happened to the remaining ones? Do we discard these embryos? These embryos are formed. We know that the male and the female gamete comes together to form the embryo, to form the zygote and divide to form the embryo. When does life begin? If you form this life outside, do we just discard it as nothing? And of course, also forming an embryo in an artificial environment. Is it right? Embarking on expensive technology that the common man cannot access. Can we justify it? Issues like creating embryos, freezing them, and keeping them in limbo for years. Because these days, after forming an embryo, you can keep it for years. The issue of destroying embryo in research. This embryo, how ethical is it to form a baby embryo and then use it for research? Is it right? Selection of embryo, you get embryo, you select. So which means that if we allow it, we keep having people that have higher qualities and then discard. God made everything together. Now we want to select. How ethical is it? Selective termination of embryo. So these all raise ethical issues. Now, if we believe that life starts at birth, at conception, and these embryos that have been formed, do we support the idea of producing this embryo just for research? Should we produce embryo for research? Are they human beings? Are they alive? What is their own status? Even if we say, okay, don't do the ones that have been, even if you say don't produce, now the ones that are left over, what do we do with it? Can we use it for research and destroy it? Just use it like the way you use tissue paper and discard? These are issues that are raised. The issue of surrogacy is another one. Surrogacy is an arrangement in which a woman carries and gives birth to the baby for a couple who wants to have a child. So, which means that a couple can just walk up to another lady and say, please, can you carry a baby for us? After you deliver, you give us the baby. So who becomes the mother? These are issues. What of the issue of cloning? People are now talking about cloning human beings. As you are seated here now, they clone you. Then you go to in the church. There are 3 of you inside sitting in the church, worshiping God. Do we allow such kind of thing? While men were still thinking about what to do about cloning. Of course, scientists were working in the lab. And in 1996, Dolly was given birth to by this scientist, Lan Wilmot, in 1996. So if we allow it, very soon we see that human beings have been cloned. And of course, what do we have? We will have human beings that have been formed in the lab through cloning. And you can have carbon copies of the same person. Is it right? Are we playing God? So human cloning was coming strongly on board. So these are issues technologies have brought and causing challenges to humanity. So, for example, issue of organ transplant. We are talking about kidney transplant, all this transplant. Is it justifiable for me to just walk up and say, look, Nigeria is difficult, dollar is so high. Please, I want to sell my kidney. After all, it's my property. Let me sell one of my kidneys to be able to survive. Or I need a new car. I need to change my car. Please, I want to donate my kidney. Can you give me 20 million? Can we trade our bodies just like that as commodities? These are issues, that are on board. So technology has thrown up a lot. And that is why, for we as Christians, we need to know what the Christian perspective of all these things. That is why it is key important that this discussion is on board. So, bioethics and Christianity, Christian perspective. The intersection of bioethics and religion, particularly Christianity, brings a unique perspective to this debate. Of course, Christian bioethics integrates theological principles with ethical analysis, emphasizing the sanctity of life. So one key thing about Christian perspective in bioethics is the sanctity of life and the moral responsibility. So, and Christian bioethics is grounded in the belief such as the inherent value of life and the concept of human being created in the image of God. If you go to Genesis chapter 1, verse 27, it is clearly stated that man is made in the image of God. And if man is made in the image of God, of course, we have to interrogate certain things we will allow, you know. So now the Christian bioethic framework came on to integrate the theological principle with ethical analysis to address modern medical dilemmas like euthanasia, like abortion, like genetic engineering. And it has evolved from early Christian teaching, shaping responses to medical practice through figures like Augustine, St. Augustine, the Tertullian, and adapting to challenges through the age. So we discover that as even before this, we discover that there's been effort to have a bioethic framework by Christians that will help to guide us in our practice, even as this development occurs. Let's go back to historical perspective, which is the past, which I call the past, the early Christian perspective on bioethics. The early Christian perspective on bioethics were deeply rooted in biblical teaching. So for us as Christians and members of CMDA, it is important to understand that for you as a Christian, the key factor here is the biblical teaching. What is the word of God concerning? Because it does not change. So the biblical teaching and the writings of the church fathers were the things that from even the time past was guiding the activities of even Christian doctors. So in the early Christian era, the sanctity of human life was paramount. So this belief influenced how Christians approach medical practice and act and dilemma. So that is one. Another thing, so the sanctity of life was one. The second one was the healing and the care. So, and this is following the example of Jesus Christ, who the Bible tells us, Matthew 8:16-17, talked about when Jesus saw the sick, he had compassion on them and healed them and healed them. So it also helped early Christians. It made early Christians to be committed to the caring for the ill and the vulnerable. And of course, that is why the early Christians, the past, they were involved in establishment of hospitals and hospices. So if you discover, like if you reflect back even in your villages and your places, you discover that a lot of the facilities, the hospitals were built by churches because that was the teaching in the past and also should be what we should also emulate even in the present. The compassion, having to care for the ill and the vulnerable through the establishment of hospital and hospices. So the early Christians, the issue of euthanasia, that is mercy killing and suicide. Early Christians oppose euthanasia and suicide, viewing life as a gift from God and should be preserved. You are not the one that created yourself. The Bible said in Exodus chapter 20, verse 13, you shall not kill. So, and that understands the sanctity of life. Abortion and infanticide, that is killing before age of 1, also were influenced by biblical teaching. And early Christians condemned abortion and infanticide. And they believed in the inherent value of every human life, even from conception. So they believe if you look at Psalm 123, verse 19, human life is sacrosanct, is the sanctity of life. And that life starts from conception. That is what the early Christian perspective of bioethics. And because of that, it never supported abortion. Augustine emphasized the intrinsic value of human life and the moral duty to preserve it. The Tertullian also had a strong stance against abortion and argued that life starts from conception, a view that has significantly influenced Christian bioethics perspective. Now, let's look at the Middle Age. The Christian bioethics continued to develop and influence scholastical thinkers like Thomas Aquinas, the philosopher, who integrated Aristotelian philosophy with Christian theology. And in the modern era, even with the rise in medical technology and the new ethical challenges that prompted further development, has prompted further development in Christian bioethics. And this is also based on the fact that, look, the sanctity of life. So let's look at the present, which is also, one can refer as the modern era. You know, in the modern era, the rise of medical technologies and the new ethical challenges prompted further development in Christian bioethics. For example, the reproductive technologies that I had mentioned. The advances in reproductive technologies such as IVF and genetic engineering raise new ethical questions. However, the Christian bioethics responded by reaffirming the importance of human dignity and the sanctity of life. So no matter the development and advancement, the Christian perspective to bioethics still remains that the importance of human dignity and the sanctity of life. Life, God gave life, and no man has the right to take the life. And also, we are created in the image of God, and that dignity must always be preserved, that human dignity. Let's look at the issue of end-of-life care. You know, people talk about euthanasia when life is so tough, difficult, you can, you know, mercy, give the person opportunity to die and go. So the development of palliative care hospice movement, often led by Christian organizations, highlighted the Christian commitment to compassion care for the dying. So for Christians, euthanasia is a no-no. Rather, even if somebody is going through suffering, how do we alleviate the suffering? How do we show compassion to that person that is dying and make him die a peaceful death, rather than helping him terminate life? Of course, key events that brought a turning point in Christian history includes the issue of the Second Vatican Council in 1962-1965, which is the pivotal event in Roman Catholic Church that addressed the contemporary ethical issue, emphasizing the need for the church to engage with modern scientific and modern medical development. He said, look, yes, we can embrace medical development, but with some clause, with more some clause. So the publication of the Humain Vitae in 1968, he said the Papa encyclical by Pope John IV reaffirmed the church stance on issues like contraception and the sanctity of human life. Now, other key events in the history of Christian bioethics is the establishment of bioethics centers, institutions like the Oxford University Press and various bioethics centers. They have played a crucial role in advancing scholars' research and public discourse in bioethical issues. So they have maintained a stand which, of course, supports the Christian perspective of bioethics. So as others are speaking, they are also speaking strongly in the whole world through their publication. So let's look at the core Christian bioethics for the present and for the institution, for the future. The core Christian bioethic framework that is very important for the bioethic principle for the present and for the future. Christian bioethics is deeply rooted in foundational principles that are derived from biblical teaching, as I've earlier said, and also Christian faith. So the two Christian, when you talk about Christian perspective in bioethics, both in the past, in the present, and the future, is deeply rooted in biblical teaching and in our Christian faith. And these three things are very core. And this is the first one, is the issue of sanctity of life. God gave life. He created man in his own image. He created man, male and female. And because he created man, life is not even your own. So you can't take the life. It's not your own. Then two, also, he made us in his own image. So with this image, we must respect it. We can't commodify it and begin to sell our body parts. We must respect human dignity and have human dignity and human respect. The issue of moral absolutism versus relativism. I will just explain because of our time, mindful of the time. So now let's take each of them one by one. Let's take one by one what each connotes. Now let's look at the sanctity of life. Sanctity of life. Sorry. of the sanctity of life, is a core principle in Christian bioethics, emphasizing that all human life is sacred. All human life is sacred and valuable. This belief is grounded in biblical teaching and has significant implications for bioethical issues. Look at Genesis chapter 1, verse 20 says, so God created mankind in his own image. The image of God, he created them. Male and female, he created them. So the image of God, affirming the intrinsic value and dignity of every person. Also in Psalm 139, verse 13 to 16, say, for you created my innermost being. You knit me together in my mother's womb. It's telling us that life starts in the womb, from conception. So it underscores God's intimate involvement in creation of each human life, reinforcing the belief that life is sacred from conception. So what is the implication for bioethical issues like abortion, like euthanasia? Of course, for abortion is a no-no because we believe that life, sanctity of life. Euthanasia, life also, it does not belong to you. And thou shalt not kill, as is stated clearly in the Bible. So another core concept in the Christian perspective is human dignity and respect. The concept of human dignity is central to Christian bioethics, emphasizing that all people deserve respect and care because they are created in the image of God. I hope I'm still being heard and I'm not talking to myself.
Yes, Prof, we are hearing you, sir.
Thank you. Thank you. So the concept is emphasized that all people deserve respect and care because they are created in the image of God. In Genesis chapter 1, verse 25, affirms that every person is made in God's likeness, establishing a basis for human dignity and the ethical treatment of individuals. So what is the ethical implication here? Basis for opposition to the practice that devalues human life. So based on this, Christian perspective of bioethics does not support any practice that devalue human life. For example, in genetic engineering and cloning, when you are able to, any act that will reduce human, to be a thing that you just work in the laboratory to produce human being, it devalues human life. And of course, the Christian perspective to it is that it should not be acceptable. We cannot play God. God has created man, and of course, we cannot reduce it to the point that we go to the lab and manufacture human being. When these are seen to undermine human dignity or to commodify human being. So any practice that will commodify human being, for example, of course, you can donate a kidney based on altruistic reason. Maybe your brother has a kidney failure and you want to save a life. You are trying to save the life. That can be ethically justifiable. But if you are trying to sell a kidney to buy a car, which means you are treating your body parts, that image of God, you have reduced it to a commodity that you can buy and sell. It becomes an issue and is not acceptable because it does not respect human dignity, it respects human life. So its application in modern bioethics, human dignity and respect. The principle of human dignity has practical application in contemporary bioethics debates. For example, in genetic engineering, Christians may support genetic intervention that prevent disease and alleviate suffering, but oppose those that enhance or alter human traits in a way that compromises the inherent dignity of the individual. So, if the genetic intervention or genetic engineering is to address a disease, for example, sickle cell disease, you want to use genetic engineering to bring a cure to sickle cell disease, Christian perspective will allow it. But if you are using it to just produce superhumans, to reduce just like what Hitler did at the point, that people that are not strong, capable should be eliminated so that we have superhumans in existence. The principle of eugenics, that is not supported by Christian perspective. Another issue is cloning. The creation of human clones is generally opposed in Christian bioethics, as it is viewed as violating the uniqueness and the dignity of human life. Now, the last, before I round up, because of our time, the issue of moral absolutism versus relativism. Christian bioethics is often characterized by moral absolutism versus the secular bioethics perspective that may lean towards moral relativism. When we talk about moral absolutism in Christianity, it is the belief that certain moral principles are universally binding and unchanging based on God's nature and revealed will. So it is absolute. What God has said, it is absolute. Thou shalt not kill. There is no rationing. There is no reasoning that will not justify it. So it is absolute. So its biblical foundation. Christians believe that moral absolutes are grounded in the character of God and are revealed through the scripture, like the 10 commandments. Those commandments that God gave, we cannot justify why we should now fail to adhere to those commandments. So that is a moral absolutism. So this perspective provides clear guidelines for ethical behavior, such as the command to love one's neighbor and uphold justice and mercy. So it is covered that this also gives us this moral absolutism that Christ said we should love our neighbors as ourselves. We should love our neighbors, and uphold justice and mercy. So it is covered that even in your practice, it is expected that what you should do are things that will show evidence of love towards your neighbor, that you uphold justice and you show mercy. These are biblical. Micah 6:8. We can look at that. So let's look at major ethical issues and Christian ethic perspective. Let's take them one by one and stop. For example, the issue of abortion. The Christian perspective on abortion is primarily based on the sanctity of human life. In Psalm 139, 13-16, emphasizes God's role in the creation and formation of life in the womb, suggesting that life begins at conception. So, and as such, many Christian denominations accept that abortion is morally wrong because it terminates an innocent life. And also, you shall not kill murder. It's shown in Exodus chapter 2, verse 13. So that settles it for abortion. For issue of euthanasia and assisted suicide, which is very common. When for my training in euthanasia, I discovered it's a very common thing in Belgium. So euthanasia was as common as anything. But the Christian ethic provides clear argument against this practice. Why? And that is based on the sanctity of life. Sanctity of life. And also, euthanasia, you cannot say, let's kill somebody, assisted suicide. Physician-assisted suicide. Let's help him to die. Because in Christendom, we say the moral duty to care for the vulnerable. Christians are called to provide compassionate care rather than hastening death. But we're told in James chapter 5, verse 14-15, we're encouraged to pray and support the sick and not to help the sick to die. So that is the position of the Christian bioethics. So genetic engineering and cloning, I've talked about that. Christian bioethics evaluates those technologies through the lens of human dignity and the moral implication of manipulating life. So the ethical concerns surrounding genetic engineering include human dignity, and that genetic manipulation should respect the dignity of the person and not reduce human to mere subject of experimentation. Playing God. Another issue is playing God. There is concern about overstepping human boundaries and assuming the role that belongs to God. We are not careful. So genetic engineering and cloning, as I have said earlier, Christian perspective towards cloning is that cloning is unacceptable because of issue of identity, individuality, and also commodification of human life. What of gene therapy? It is accepted when it is to prevent or cure disease, but it's controversial when it is aimed at enhancing human praise. Then lastly, end of life care. Christian ethics provide guidance on balancing the alleviation of suffering with respect to sanctity of life. So Christian ethics in palliative care and hospice. So Christians support palliative care, and hospice as a way of showing compassionate response to end of life suffering. So caring for these people, ensuring that they die a peaceful death. So Christian perspective advocates for a balance. Sanctity of life. Life should be preserved, but not at the cost of undue suffering. Also, comfort and compassion. Providing comfort, easing pain through palliative care aligns with Christian value of compassion and mercy. So in conclusion, Christian bioethics offers a comprehensive framework for addressing major bioethical issues. And these are grounded in biblical teaching and the principle of Christian faith. It provides clear guidance on complex ethical dilemmas, ensuring that human dignity and the sanctity of life remain central to all discussion. Thank you for listening.
Thank you, sir.
Thank you so much, Prof. Thank you so much for this very elaborate presentation. It was quite insightful for me, and I know every one of us on this call. The sanctity of life, dignity of human life, the commitment to caring for the vulnerable and not to hasten their deaths, and the absoluteness of the Word of God as the core for Christian bioethics. Thank you so much, Prof. I really had a lot written down during the presentation. Thank you, sir. So we are now going to entertain questions and answers. Are there, okay, yes, I'm seeing that we have questions on the chat box. Okay, so we'll take the questions. If you have questions, you can also put your questions on the chat box. I would read out the first question we have, Prof, and then you can answer them. The first question here is, what is your view on abortion or preterm delivery when mother's life is at risk? What of abortion in severe congenital anomalies like anencephaly, ectopia cordis? Thank you so much, Prof. So that's someone's question.
Thank you very much. Say, what is your view on abortion? I think that has been addressed from the Christian perspective. Sanctity of life. Life starts from conception. God created man, and as a such, we do not really have the power or the right based on a Christian faith, because I say it's based on biblical principle, and our faith in Christ. There's no way it was written that we should. So for abortion, based on the biblical principle, it is not not acceptable by the Christian faith, because it's believed that life starts at conception. So why do you need to terminate that life? The issue of preterm delivery when the mother's life is at risk. Well, you see, preterm delivery when the mother's life is at risk. Thank you. You say it's preterm. When a woman's life is at risk, your aim of delivering that baby is to save a life. You have respect for the sanctity of that life. The woman in the act of procreation, in an attempt to fulfill the Lord's command to go, multiply, replenish, fill the earth. And now her own life is at risk. So the purpose of that termination of the pregnancy or preterm delivery is to save her life. And even when the baby is delivered, it's not like you just deliver the baby and throw the baby away. That is why when you are delivering preterm, the next question we ask, what preparation have you made for the baby that is coming? So you discover that you are delivering at 30 weeks incubator care. So you have a plan. So you didn't just deliver to throw away the baby because you don't need the baby. You are trying to save the life of that woman. So it is morally acceptable. In fact, you are trying to save a life. And now you have delivered this other baby, and this other baby is now disadvantaged, and you are still providing care. Even if the baby ends up dying, you are not God. You are not a creator. You were doing everything to save the baby's life. Just like as doctors, we don't give life, but we try to preserve life. So you do their best. But if the patient ends up dying, doesn't mean that you are the one that killed the baby. So what of abortion in severe congenital anomalies like anencephaly, ectopia cordis? Well, these are very controversial areas. These are very controversial areas in the sense that this baby is in the womb, it has no head. So, as a matter of fact, it's almost concluded that a baby cannot survive. Because if it's a baby that just has an anomaly, I would say, okay, because when it comes out, there'll be a chance. For this one, you mentioned specifically anencephaly. There are still some people that strongly believe that they are not the one that created life, and they entered into that womb, and will not, based on Christian faith, not terminate that pregnancy. No matter how you look at it, may look difficult. So the woman has to carry a baby that is anencephaly for 9 months only to deliver. But I tell you, even in practice, good number of Christians will stand by it that, look, I cannot terminate that pregnancy. However, I'm aware that opinion changes. Now, when you now begin to talk about core ethical consideration, you know, we are discussing Christian perspective. If there's a Christian perspective, strictly on Christian perspective, there is no room. I've not seen it in my Bible whereby they say terminate because there is no head. You know, but bioethics, in the secular bioethics, people can argue using other bioethics principle to justify the termination, that this baby cannot survive. Why wait for 9 months? A woman going through a rigor, and sometimes they can even develop polyhydramnios and all those stress, only to deliver a baby that will not survive. So the secular bioethics will argue more in terms of terminating that pregnancy. But you still see people that, based on Christian perspective, that look, life is given by God, and He's the only one that has the right to take that life. I want to stand by that particular injunction. Great.
Okay, thank you so much, Prof. There is another question. If we find ourselves practicing in a state that supports any of these bioethics issues that is against our Christian faith, example, abortion or euthanasia, what should we do?
Very good question. Very good question. I have been, for example, in Belgium, where I did my bioethics. Abortion is very common. People can do it, procure abortion. Now, as a Christian, that is why from day one, you must identify who you are. It's just like even in your village. If you do not want to have so much of problem in your village, from day one, identify that you're a Christian, so that everybody will know you for who you are. And they begin to respect you and honor you for who you are. So the first thing that people must know where your stand is. Now, if you are in a place, there are some hospitals that they will designate as abortion center. Let me use that. They may not call it abortion center, but it is known for abortion. There is no reason why, if you are looking for a job, you don't need to go and look for a job there, because that is what they do. They are professional in that area. You can seek for a job in other hospitals, whereby some may not, so there are some that don't offer abortion care. Even where they offer abortion care and you're working in a hospital that offer abortion care, there is what is called conscientious objection. Reason being that you, as an autonomous agent, you are a doctor, but you are also an autonomous agent that have a right over your own life to decide what you will want to do or what you wouldn't want to do. So you cannot actually be forced to do what is against your own belief, but you must have declared your own belief. But in that case, there is a clause there. In those a client, when in that hospital, even if they commit abortion, they would have known that you do not. And when a person comes to you to terminate the pregnancy, you can also let them know, no, in ethics, as conscientious objection is permitted and is allowed. But the only requirement is that you tell the person, sorry, I cannot offer you this care because of my own belief. However, this hospital, there are others that can do it. You can approach them for that. But for me, I do not do it. That is elective case. If it is an emergency, it is expected, for example, that in those clients, they want you to refer, to tell them, okay, let's say they don't do it in that facility, but there is a place they can do it. It's expected that you can also refer. Say, look, I don't offer this abortion care. I don't do it. It's against my own belief system. However, you can go to so place. I'm aware that you can do that for you, but I don't do it. Nobody will hold you. But if you see an abortion center hospital and you go and seek for employment there, and you saw the terms of employment, that here we do abortion, and you accept to work there, of course, you are expected to do it. Because so you have to first of all take a bold step and do not go and seek for employment in an abortion center so that you will not have problems.
Okay, thank you so much, Prof. Okay, so Professor Babatunde has been raising his hand. So can you go ahead and speak or ask your question?
Thank you very much. I just want to give a few comments. As someone, elderly person in the medical profession that is versed in this field. But for people to understand it, I need to put in some few comments and then I'll put it in perspective. There are some things that we can't all answer. That's the first thing. And it's true. You can stand on your ethics, but there are consequences. Now, I'll give you a scenario. Some of them happened in the Bible, some happened even in this country. Remember when Solomon was confronted with a child and two people claiming that the child was there, that child was alive. What was Solomon's decision? To kill the child and divide into two. You will wonder, why did they say that? Because it was possible for the mother not to talk, but at least that ended up solving the issue. But remember, his answer was that they should kill the child and divide into two and give one half. So, which means many of these things is with wisdom. It's not possible to legislate, and has been answered a little bit. You see, because it depends. If you are working in a Christian facility outside this country, whose views align with your view, you can be okay. But if the view is contrary to yours and you go to work there, guess what? There are consequences. You can be terminated. We should be ready to, if that occurs. But that's one of the things. The second illustration that I want to give is having a soldier, the best snipers in the world, and who are Christians. And they know that they're going to kill somebody. That's part of their profession. And they go ahead and eliminate that person. How do they feel that the Christian role comes to play? That shows you that there are instances that not all of us can go and practice. Now, this thing happened in this country. There was a woman in the north, I won't say the area of the north, that had a heart attack and was going to be resuscitated by a youth copper. As the youth copper doctor there was a male. As the youth copper was going to compress the chest of this woman to save her, someone who was wise yanked the doctor away, and he kept looking at the woman. There are two things. It had a positive outcome. But why did the person yank the doctor away? That was a strictly Afghanistan type of Muslim religion center. He knew, she knew that if that doctor had compressed the chest of this lady, they will lynch the doctor. And that's why many of these things calls for wisdom. There are instances that your faith is going to complete with practical reality. That is the time you need wisdom, and you have to be prayerful. But having said that, it's not easy. because there are consequences. The area I want to talk about, that I want the speaker to talk about, is this area in which Christian doctors, because I deal with a lot of cancer, I'm an anatomic pathologist, they go and perform an operation on a patient and they find out that it's inoperable. Rather than tell the patient the truth and sit down, they will say, the operation was successful, and they will not give the details. And many times families have been devastated because they have depended, quote and unquote, on what the Christian doctors say about a successful operation without giving the facts. Where's the ethics in that? I've had to come in a lot of time because while I trained both in this country and outside this country, and I know it's because here we don't sue. We get away with quite a lot of things because nobody sues. So bioethics, very, very important, but depends on your environment, and also you need wisdom. And the wisdom I'm talking about is the wisdom of God, because it can result to death. Finally, this is also a true story. A 16-year-old, 16-week pregnancy. That's not a child already, has not been fully formed. And then the life of a mother is in danger, maybe bleeding, having DIC. What do? Do you wait because you don't want to terminate the child, because you don't know whether the child is the source? Because there are many things that, it's an ONG person talking, or you wait for both to die. There are so many conflicts, but if you have to terminate, then you are killing a 16-week-old baby, not full-time. Serious cases have happened, and then you know that, okay, what do you do? Or a Jehovah's Witness that comes to you and say, well, my child does not need blood. Oh, you can't transfuse my blood, my child with blood. It has happened in UCH, and people have watched. In a few instances, some people, Christians, have gone ahead and said, to hell with it, I'm going to save this person. But you are going against the parents' wish. Many have ended in court, and some have been vindicated. But it's not that easy. If you have just left the child to die and say, well, I don't want to go against what is going on. So many of these things is not black and white. We need wisdom, we need understanding, and we need revelation. Thank you.
Thank you. Maybe I should also respond. Thank you very much, sir. You brought up very practical terms, realities. And I'm so happy about it because it really shows that you are really in the field. You see things practical. And I'm happy about that. Well, the issue is this. Let me start this way. The one you talked about, Christian brothers, did an operation, inoperable case, and you tell them all is well. That is unethical. Is unethical. Number one, you are not expected, as a doctor, you must be sincere. You must present facts in a way the worst individual must understand it. If you saw a case was inoperable, for you to come out and say all is well, that's not proper. It's not proper. You must tell them, if you are waiting even for histology, you must let them know that, well, we couldn't go further because of the challenges in the surgery. We just took a specimen, we have sent it for histology. When it comes back, we will tell you exactly. We must, as much as possible, carry the patient along, let them know the true situation. Sometimes we give them a false hope, and they keep spending and spending on that whole false hope. So, for me, that is not acceptable. It's ethically wrong. Then, another thing again is that, well, sometimes in ethics, it's actually difficult to have one answer. That is why it talks about what is the best, what is the best thing to be done, all things considered. So sometimes the decision you may take here may be a little different from the decision you may take because of the culture, environment, where you are. Now, so when you run into a dilemma, let me just explain. If in the developed client, when they run into ethical dilemma in their clinical practice that is serious, it's expected that they report to clinical ethics committee that has a group of people from different fields to discuss the issue. Now, for you in this environment, what I advise people is that when you run into ethical issues, for example, you want to try that a Jehovah's Witnesses, no. Don't go ahead and transfuse because you feel you must save a person's life. Rather, report the case. If you are in this country, report a case to the authority. If you are in a department, report to the head of department, who is expected to escalate it. If it is a teaching hospital, to the chairman, medical advisory committee, who will also escalate to the legal team. Many times you run into a problem as an individual when you take a decision that should have been a decision by the institution. Because if you transfuse, you can be singled out. But if you escalate it, because we don't have clinical ethics committee, virtually most centers in Nigeria don't have clinical ethics, so there is no way you fall back to. But what we encourage people is fall back to the management so that they can also fall back to the legal team. Once that is done, decisions that are taken, you are to a great extent protected. Than when you take a decision just yourself, you may suffer the consequence alone. Then coming to issue of trying to save a life. For example, as a gynecologist, we have cases of ectopic pregnancy that is there at the tomb. Conception has occurred, life is in that baby, but the woman is bleeding. What do you do? These are all issues. What do you do? Do you watch both the mother and the baby and the forming baby to die? It's a difficult scenario, very difficult one. You say, okay, that is, thou shalt not kill. You watch both the mother and you know that if you leave the baby will not survive in the first place. It was implanted in the wrong place. So ab initio, it will rupture, and when it ruptures, the woman will die. So there is no hope for that baby. For leaving that baby will cause the death of the mother. So most bioethics, we go ahead they are not going there to terminate the pregnancy. The perspective on which they are working upon is to save the life. That is the predominant thing there, to save the life of this woman. Her life is at risk. So the collateral is that the baby, of course, in the womb that naturally would have, in the tomb that naturally would have died. That is a collateral. But the principal mission is to save the life of the woman. Then also, so there is a lot of ethical issues. Sometimes it's a dilemma. What should you do? It's not just as simple, as straightforward as this lecture may be. No, it's quite complicated sometimes that you need to have. That is why some places that a committee from different spheres analyzing it to come out with what is the best situation, what is the best, all things considered. Thank you.
Thank you so much, Prof. We just have the last, I'll just read out the questions and then you can answer all of them once, although they are bordered on mostly surrogacy. So the question says, can you share your thoughts on surrogacy and IVF, that's in vitro fertilization? We had 2 or 3 more questions still on surrogacy. Then the final one is, are there situations where beneficence supersedes autonomy? And will AI impact our core ethical principles, our known core ethical principles? These are the final questions, after which we'll be through with the question and answers.
All right. So the first one says, I'll read it here.
Can you share your thoughts on surrogacy and IVF?
On surrogacy and IVF?
Yeah.
I think I had actually done that. When I talked about surrogacy, I showed a picture of a couple approaching another young girl to carry a pregnancy for them. And at the end of the day, hands over the baby to the couple, So there is now total disconnect. So who is the mother? Is it the one that carried the baby? Or is it the one that his baby is being carried for? Another issue is, did he even contribute genetic material? These are issues. Like in a country like ours, that's why ethics is important, that there is no clear-cut law, regulation on these things. So you see these things being done sometimes it's very exploitative, in the sense that these people are just paid money, no money transactional. Transactional, you pay money, do this and all that. When it is transactional, ethics frown at that, So, but people have said, okay, is carrying the baby. There are ethical issues that are there, just like even in vitro fertilization I have mentioned. I listed series of ethical issues that are in vitro fertilization. So, which, of course, I discussed. So I don't know the angle you want me to share my thought, whether it is the IVF should be allowed or not be allowed. Of course, IVF, there is it depends on what you are doing. The early part that came out in that 1978, when the issue came on board, the announcement came on board that a baby has been born, and Louis Brown, was the issue of, is it ethical to jump the natural conception? Why will you conceive outside the two? It was a big debate, but now generally it appears that is dying down. A lot of people are now doing IVF, both Christians and everybody doing that. Once life it respects the sanctity of life and human dignity. So I would not say that Christian perspective is against it, against IVF, no. But any form of assisted reproductive technique that will affect the sanctity of life or reduce human dignity, that will commodify, selling human parts, you are doing transactional to make money out of it, is unethical and not acceptable. Then, is there a situation where beneficence supersedes autonomy? In clinical setting of today, modern day, autonomy supersedes beneficence. What do we mean? In those days, in the past, in fact, if you do anything contrary, you'll be accused of paternalism. It is expected that you share information with your patient, let him understand. That is why the issue of informed consent. What you want to do with your patient, who is an adult that has the capacity to make an informed decision, is expected that you tell him the treatment you want to offer, the other options available for that treatment, and you make sure you give him information that is enough for making decision on that issue, and that he's able to comprehend, and then without coercion, force, or anything, is able to take a decision. And that decision, if it is well informed, it is expected that you should abide to it. That is why a person that has diabetic foot and refuse amputation to save his life, you cannot take the person to the theater to amputate that leg, because I know if I amputate it, you will survive. When he has said, don't amputate, provided you are sure that the person is not mentally in any way mentally affected and is capable of making decisions. So beneficence cannot supersede autonomy in modern practice. However, where you cannot get autonomy, for example, in emergency, there is a bomb blast, boy, and he has injured people. People are bleeding. At that point, you cannot go to be asking somebody bleeding that is almost unconscious, do I treat you? Do I not? Do I amputate you? Do I not amputate you? So in emergency, beneficence approach is core in emergency. So you are doing things to save a life. So beneficent-driven activity. So what you are doing is what you feel that is best for that individual. So you can even amputate the leg of somebody that is a bomb blast to save the person's life. But once you have been able to control bleeding and that person did not die and is now no more a threat of death and is now cognitively sound to take decision, you cannot do it at that point again. It must be with his own decision. So in a solution, in summary, it is a term paternalism when beneficence overrules autonomy and is not acceptable in modern day practice. Then, the next second question. I moved it and it disappeared. How should Christians practice in certain climate?
I think that has been answered previously. The last is on AI, the impact of will AI impact
on the no core ethical principle. Will AI impact on the no core ethical principle? When AI is coming on board to do so many things and even trying to take over activities of human. But for you as a doctor that is seated, those core principles must guide you. Those core principles must guide you. The AI can help you to make your diagnosis. But if you are a professional, you are also expected to be sound clinically, to even interrogate certain, for example, you are a cardiologist. AI can help you interpret maybe you did an ECG or some of those results. You can use AI to interpret and give you diagnosis and all that. But the onus is still on you with your professional knowledge to also look at the result that AI has given to you to interrogate it. To say, yeah, okay, more like it. It's supposed to enhance, but not to take over. AI is supposed to enhance your activity, but not to take over. Because AI does not, in fact, it's a developing area now, the ethics of AI, in medicine. There's a new area that is coming on board and all that. But it's also, the onus is also on you that you should be able to marry what is telling you with your own professional knowledge to be able to help your patient. But as far if it's going to impact on our practice, it's already impacting on our practice. But those ethical principles are still very, very important. Thank you very much.
Okay, thank you so much, Prof. It's been a very wonderful and enlightening moment, and we thank everyone who have asked questions and has helped to enrich this discussion. So